May I have a quick word with you, sir? Not here. I prefer not here. If you could just come outside. No, I really need to speak to you outside. Well, unfortunately, we need to speak to you outside.
We have just been told about half an hour ago that they are going to take the tube out and our daughter is going to die. So, to be honest, do you know what?
I'm not leaving.
All we are asking your husband to do is step away for today, let her have some care, and he can revisit when the doctors say that is appropriate. That is a reasonable request. It is a reasonable request.
That's not what they have done.
But that's what we've informed. That's what we're here to do.
I know. What have you actually been told? Were you told half an hour ago, Dr. informed us that they were going to take the tube out?
Yes, but they're not doing it right now. They're not doing it right now. They're not going to do anything without informing you.
Do you know what compassion is?
Yes, I do. Hence the reason I'm here, trying to plead with you from one mother to another. This is not right. Please ask your husband to do the right thing.
Doctor, that's the next step, unfortunately.
Cannot witness this.
That's the next step.
Please, do you know how much I have to deal with?
Yes.
Can you jump up, please?
Listen, please. No, please.
I'll ask you one more time. Is there anything I can reasonably see her do to get you to leave this? Leave go your daughter. Leave go. Get back. No. Leave go.
Mrs. Abbasi. Mrs. Abbasi.
Leave go. Leave go of your daughter. Leave go of your daughter. What are you doing to my rights and yourself for? What are you doing to my... On the floor.
Stop fighting! Stop fighting!
Right.
You're breaking in! Bastard! Oh, gosh. Calm down. I've got chest pain.
Right.
I've got chest
You
pain.
brought this on yourself.
We'll take you to A&E. That's absolutely fine. Right, please come with us and act responsibly. You're an adult. You're an educated person. Can we get a trolley?
Stand up, please.
Right, we'll get him a trolley. We'll just wheel him out.
Yeah, up you get.
I've got head, chest pain. I've got chest pain.
Right, we'll take it in even.
I've got medicine in my pocket. I want to have some.
Right.
I've got medicine in my pocket.
Right. If you sit up reasonably on the chair, we'll get you medication.
I can't. I'm feeling dizzy.
Right.
I'm feeling dizzy. Why are you pulling me?
Sit on the chair. It's just there.
I can't.
You can't.
Let me on the floor. Why are you kicking me? Why you are kicking me, you bastard? You bastard!
Calm down.
You bastard!
I'm not kicking you. I'm not kicking
You
you.
did! You can't even... What are you doing?
Come down.
I'm down.
Put your head to the side. Put your head to the side. On. Put that one.
I've got chest pain. Let me have my medicine. I've got chest pain. Let me have my medicine.
We will. Calm down first.
Let me have my medicine. I've got chest pain. I will have a heart attack.
You will. Calm down.
You
Calm.
rascals. You animals. You
Right. Put him on the bed. One.
animals.
To your hand on the legs.
Get up. Body. 1, 2, 3.
You animals.
Don't kick me.
I didn't kick you.
Yes, you did.
I didn't.
You're acting like an animal. It's disgusting.
You are an animal.
Get him out.
You are an animal.
Get him out.
Father sitting at the bedside of his dying child, dragged away by police officers, handcuffed, restrained and arrested. That is what you see in an 11-minute video of an incident at a hospital last year. This is part of it.
What are you doing to my rights and yourself for?
The footage from police body cameras shows officers approaching Rashid and Aliya Abbasi as they sat at the bedside of their daughter Zainab, who was 6. They had just been told that her life support was to be switched off, and they'd had numerous differences with doctors about her care. Both are doctors themselves. The hospital had called the police. You can see in the video Zainab's mother tell the officers the news they'd just had, and her father refused to step away from her bedside where he is holding her hand before he is forcibly removed. When we spoke, Rashid Abbasi told me first about Zainab's complex needs from a degenerative condition called Neumann-Pick syndrome and the after effects of swine flu.
In 2018, she had another episode or flare-up of her lung condition. This was after another viral infection, and she required ventilatory support. That was January 2018. At that time, again, we were advised that it would be kind if we let her go because she's unlikely to pull through, and most parents would do that and go along with medical advice. It was at that time that we thought that, we shouldn't really go along with that medical advice because their advice was based on how Zainab looked when she was struggling to breathe. But we knew a girl whose baseline was much better. She had a good quality of life. She would interact with her brothers. She would have good non-verbal communication skills, and she would watch her movies. She would select her dresses. Yes, she was disabled in the sense that she could not walk, she could not run, but she had a working mind. And on that basis, we said, no, she should be given chances and see what happened. She pulled through. She responded to treatment. This time she spent even less time on ventilatory support and was able to come home and did not require any hospital admission for a year. But at that time, I think the disagreement with hospitals was becoming apparent. We were forced into a situation where we were labeled as people who were argumentative. We were fighting for our daughter, and I thought that should have been taken as our strength to fight for our daughter and do what any normal parent would do.
At the time of this incident involving the police, it was 2019, she was 6 years old and in a very severe condition in the hospital. What had you been told by the doctors just before the police officers approached you that day?
I mean, that was 3 weeks into another illness with chest flare-up, and she had to be put on life support in our local hospital. And it was the same saga all over again. But then this time there was a determination from our healthcare colleagues, and this is my personal feeling, and I can back it up with the evidence based on the treatment that she received, that she was set up to fail extubation. She was given the right treatment, but in lower doses that was necessary to ensure that she would improve. I was in a position to challenge their decisions based on my background because I am an adult respiratory consultant of over 20 years standing. So on the day when the police was called in, we were involved in about 20-25 minutes meeting, who told us that they have decided that they would take her off the ventilator, remove her tube, and allow her to die. And that would be very rapid. And the day previous to that, they were talking about optimizing her treatment and then giving her a chance to survive by supported withdrawal of ventilation over a period of days. But on that day, we were told that they are not going to go down that way, and they are going to do it then, and they won't listen to us. We would never let her go, and we were being unrealistic. And at that point in time, I felt that they may well actually be doing it whilst we were in the meeting with them. So I stood up and left to walk to my daughter's bed space, and a consultant who was sitting and talking to me, he actually ran past me and tried to block my entrance into that room, saying that you are banned from being with your daughter at night.
And in the footage, the police body cam footage, you are seen holding her hand at her bedside, and your wife tells the police officers that you have just had this news that she's going to have her life support removed shortly. They
Yeah.
ask you to step away from her bedside to discuss concerns about your behaviour.
Yeah.
And when you
I
heard
mean,
that request, you refused.
I did, but I asked them if they have a legal reason to remove me, if they have got a court order, a police order, a arrest warrant. If they do have it, they can arrest me and I will come with them. I would not leave my daughter's bedside voluntarily just to talk to them, because I knew that if I stepped out, they would not let me in and they might actually use that opportunity if I'm away from her to remove the tube.
Is it fair to say that your relationship with the hospital had completely broken down with those caring for your child? That their statement says that they only seek help from security staff or police when they feel that there's a risk to the safety of their patients or obstruction or interference with the delivery of care and treatment.
Yeah, but the thing is, what was the risk? Has anybody? I mean, it's a very generalized statement. But what did I do? What was the threat?
You end up on the floor. You end up then being physically restrained, your legs strapped together, and you are wheeled out of the area. What happened immediately after that?
First of all, a police officer was asking me to leave, and I said, no, please, if there is a legal reason, show me and I'll come with you. Zainab was holding my finger, and her grip, you can feel how strong it could be, a dying child. And another police officer, he held my wrist, and the other police officer grabbed me from the neck, pulled me across, and there were 4 people suddenly attacking me. And I mean, they came apparently because I assaulted somebody. If I, according to their statement, if I assaulted somebody, they should have come with a warrant, arrested me, handcuffed me, and took me away. I was never charged. I was never served with any notice of assault. And to this day, I am waiting if I'm going to be charged for anything that I did, which justified their action.
It must have been incredibly distressing for you to experience this, for your wife at the time, that Zainab only had a few weeks to live.
Exactly. I mean, I can't put it in words, Shall. I can't, even if I tried to. We obtained this footage after a lot of effort, and even when we received it weeks later, I had to develop a lot of courage. It took us weeks before we could convince ourselves to watch it.
You have worked for the NHS yourself for many years. Do you think this experience has changed your relationship with it?
There is a bias against disabled. And now I'm forced to think that if I was John Brown, or I was not Rashid Abbasi, my daughter or I would have had better treatment.
You think race was a factor?
Well, I didn't think that was the case. And I have been asked this question recently, repeatedly, and I think there is some truth in this argument.
And it is now nearly a year since Zainab died. How are you and your wife now?
We are still living the nightmare. I often wake up in the night feeling as if somebody is pulling tube from my daughter and tightening my handcuffs.
Dr. Rashid Abbasi, thank you very much for talking to us. Well, the Hospital Trust, which we are not naming for legal reasons, says that the decision to involve police and security staff is never taken lightly. It is essential that we maintain a safe and secure environment for our patients and families. Our staff always go to strenuous lengths to ensure that families' wishes are respected and that they are supported as they approach the end of their child's life, and make all possible efforts to ensure that this is peaceful and dignified. The Trust has also denied the allegations made by Dr. Abbasi about deficiencies in his daughter's care and that racism was a factor. The police force involved told us, "We responded to a call of a man being violent and abusive towards staff and that he had assaulted a consultant. While we recognise this was a very distressing time for him and his family, our duty was to ensure the safety of all those present. Due to the nature of the incident, it was necessary to detain the man. We can confirm police have not pursued any further action against the individual. We are in the process of reviewing a civil claim, so it would be inappropriate to comment any further." The time is